The cystic fibrosis community is invited to participate in a series of videos and podcasts on individuals that are living, breathing, succeeding with cystic fibrosis. This video, CF Airway Clearance Options, the frequencer, has been made possible through an unrestricted educational grant from Genentech to the Boomer Esiason Foundation. Today you will meet Gunnar Esiason, 24 years old with CF, sports enthusiast, active in hockey, coaches high school football and hockey, a blogger, and the CF ambassador and program director at the Boomer Esiason Foundation.
My name is Gunnar Esiason. I'm 24 years old with cystic fibrosis. I was diagnosed at age 2. Since college ended in 2013, I've been a bigger part of the Boomer Esiason Foundation. I've got my blog at gunnaresiason.com. I work with our scholarship team as well as coaching high school football as well as hockey. After college, my health definitely took a little bit of a downturn. I think college will do that to anyone, but my health is definitely coming back. I've really prided myself on taking pretty good care of my health and making sure I stick to my treatments and being compliant in all senses of taking care of cystic fibrosis, whether that be nutrition or my daily treatments. Yeah, I do my best to stay active, especially during the hockey season. I'm on the ice probably 3 or 4 times a week, and then even through the summer and spring, I'm always on the ice. So airway clearance is definitely one of the more important aspects of taking care of cystic fibrosis, in my opinion. Besides exercise, there are different types of airway clearance. I've been familiar with the vest, I've been familiar with the percussor, but more recently I've been using the frequencer as one of my preferred forms of airway clearance. So what the frequencer does is that it sends sound waves through the chest wall into the lungs to move and loosen up the mucus, allowing me to cough it out and then clearing my airways. Frequencer is flexible in the sense that it has a few settings. You can set the frequency at which it will perform its task at. The beginning process is just figuring out what works best. It's a little bit of trial and error. My doctor told me basically I had to go home for the first week and figure out what worked best for me in different parts of the lungs. Obviously the airways are different sizes and shapes depending on the part of the lung you're talking about. So the frequencer has to work at different frequencies in order to attack those airwaves. So the way I use the frequencer is I plug it in, I put it on the setting that I desire, setting that I want for the portion of the lung that I'm going after. Then I start it up and just put the cup over my chest and let it do its magic. So what I'm going to do here is I'm going to use the computer screen, adjust the settings to regulate the frequency and the treatment intensity to suit my needs here. So it doesn't really matter what I'm wearing. I could be wearing a t-shirt or pajamas, or I could even put it directly on my skin and the frequencer will still get the job done. The great thing about the frequencer is that you can just really put it on the front of your chest or the side, and it will attack the entire lung that you're targeting. So if I put it on the left side of my chest, it'll attack my left lung front and back. Maybe if I want to go from the side, it'll just attack it from a different angle, but I don't actually have to reach around and put it behind my back. What this does is it allows for a bit greater flexibility with different positions on the couch. If I want to lay on my side, it'll create a scenario in which I can attack the airways from that angle. It's designed to go 3 minutes per part of the lung. My doctor told me it's really up to me whenever I feel like I've done the job. That's when I move on to the next portion of the lung. If I'm doing my frequencer with a normal course of treatments, I can be anywhere from 20 to 30 minutes. If I feel like I want to go after a plug in a certain area of my lungs, it could be a 5-minute thing until the plug comes free. If I'm not feeling well, I could be on the frequencer for over a half hour. It's really pretty flexible in the way I can use it and the time that I'm allowed to use it for. Yes, the frequencer is absolutely effective. It's mostly effective when I'm trying to target a specific area in my lungs, especially when I have a plug or if I feel like I have pneumonia. There are certain areas in the lungs that definitely are more problem spots for me, and the frequencer is super effective in clearing those parts of the lung out. I know some people don't love chest PT because of the uncomfortable feeling that's brought on by it, but the frequencer is in no way, shape, or form painful. The first time that I used the frequencer was, I think it was 2009, 2010. I fell in love with it right away. So we put it through the insurance and got a frequencer device, and I've really been using it ever since. The frequencer definitely makes me cough during it. If I'm going after a plug, the frequencer, I'll finish the treatment once the plug comes up. But if I'm doing the frequencer during my normal treatment sessions in the morning or the evening, I'll definitely cough up my normal mucus that I normally bring up. It's really prescribed to use twice a day, just like any other form of airway clearance whenever I'm doing my nebs. But if I'm getting sick, I noticed that I could be using it 3 or 4 times a day, depending on the severity of my illness. My favorite thing about the frequencer is that it's pretty quiet. It's not going to interfere with my studies or TV shows that I'm watching. It's also really easy to store. I could bring it anywhere I want. I could bring it to the workplace. I had it in my dorm. It didn't take up a lot of space. I just left it under my bed. I can use it even though I have a G-tube. There's no hindrance to the G-tube. It's really just the flexibility of it and allowing me to have a free hand is really a big plus. I do love the frequencer. I think it's very effective, and it's a great treatment option for a lot of patients, especially ones who have chronic infection in certain areas of the lungs, or if there are people who always have plugs that they're trying to get up. The frequencer is definitely a viable option for people who are struggling in that regard, who feel like they need to get a little extra help coughing something up. And it's definitely something that I would recommend for other patients.